Some of the patients at highest risk of death in emergency departments are given the least amount of attention. And this isn't just my shop, this is shops everywhere. And I'm talking about people struggling with addiction, right? So if you imagine chest pain radiating to the left side, I can't breathe, profuse vomiting, any trauma, any surgery, immediate attention. A lot of ERs, even the busy ones, they come to the front of the line for good reason, right? Like ACS, trauma, internal bleeding, CHF, ESRD, COPD, any of the acronyms, right? Like terrible mortality, aortic dissection, front of the line. Even if clinical suspicion, not quite there, right? For addiction, the clinical suspicion is there. Like the answer is already there for you a lot of the time, right? Like this guy here with alcohol abuse, constantly here for alcohol abuse. He's sobering up, he's withdrawing a little bit, and he's going to leave AMA because he doesn't want to go to rehab. Like we don't even think about that sometimes because who has the time, right? Like if we have to see a couple patients an hour, a lot of time you don't have the space to sit down and have a serious dialogue and really try to grapple with someone's concept of their own addiction and how serious that is. But I really wonder how much benefit if we just cared like 5% more. Because I've started some pretty good conversations with, hey man, like we're on a concerning trajectory here. Like I worked these 6 days in a row. I have seen you 3 of those 6 days for the same thing. Are you concerned about the trajectory here? Even though I'm very addiction medicine, I think is super cool, super meaningful. I don't want to put my passion for that on other doctors, providers, whatever. But if we cared just a little bit more, I think that could really help some people. They are often the sickest people with high mortality, and they shouldn't get the least amount of attention.